I like to characterise our relationship as robust but cooperative, and I think that's a very valuable way to work and very much appreciate it. I also want to take the opportunity to acknowledge our commissioners, Andrew Jacomos and Kate Jenkins, my parliamentary colleague Jenny Makakos, Jill Callister, the Secretary of Department of Human Services, sector leaders one and all, and also take the opportunity to acknowledge and pay my respects to the traditional owners who've loved and nurtured the land we meet on today for many, many hundreds of generations. It's actually a pleasure to be here at Zinc. This is also a special place for me. It was actually where my husband and I had our wedding reception. And so it brings back many memories, and I'm very pleased that they were all happy ones. So it's good to be here today. And it's wonderful to be able to follow on from the Premier and from Julia some very thought-provoking and positive conversations that have been had. And I have to say, and I think you feel it as well, how delighted I am that the Premier announced a further $30 million over 4 years for family violence initiatives. And it does take the funding, as he mentioned, in the specific family violence services to well over $100 million every year that's invested. And between the budget initiatives and today's announcement and the support of Annie North, a $55 million package. So it's a very significant investment, but importantly, in addition to investing, it's investing in the reform, the expansion of the strengthening risk management initiatives, reform of the front end about how we all deal with those police referrals and reports, as well as capacity into the response that we have for women and children experiencing family violence. And particularly making sure that we can coordinate, that we have timely support, and that no matter where you work in the service system, whether it's the courts, the police, family violence services and broader human services, that we are all part of a coordinated response. And I like to think of it as a very practical package of positive change to help women and children get their lives back on track. It is a very exciting time here in Victoria, and it's interesting, I'm hearing from Julia, many of the challenges and discussions that we're having are discussions that are replicated across the country and actually across the world. And despite the terrific work of our professional and volunteer workforces, we don't always seem to be making as much progress as we would expect against the indicators that we have in terms of disadvantage, and we see it all, and you all live it every day. The very significant annual increase of child protection reports, 14% per annum, actually expected to be around 110,000 reports next year. It's a huge number and huge growth. Out-of-home care rates growing at about 5% per year, and for Aboriginal children even higher at 9% per annum. Homelessness between 2006 and 2011 increased by 31%. And family violence reports, as we've been talking about today, 21% increase last year to this, 70% increase since 2009-10. And I think it's interesting that often the work that we do, we achieve incredible results with individual clients or even cohorts of clients, but often we can't replicate the positive change across the board. For families right across Victoria and for those experiencing disadvantage. There are pockets of disadvantage that we all know haven't budged in decades. And so I think some of the challenge is how do we get that broader reform agenda so that we can make sure that no matter where you live, no matter what your experience is across this state, that you can be part of a positive process, a responsive process for very complex issues that families face. I do feel incredibly fortunate to be the Minister for Community Services in Victoria. In this state, as I have said many times, we have a strong history of a very vibrant community sector and very vibrant community sector organisations bringing strong values, a strong sense of mission, strong community recognition, and a dedicated workforce and volunteers addressing the social challenges that we have across the state. And as a government, we absolutely value and respect the work of the community sector, recognising your vital role in the sector, in the broader community, to make sure that we can assist and support vulnerable Victorians. And sometimes, despite the passion and the commitment and the dedication of the sector, and despite the billions of dollars and the millions of hours volunteered, we do still face those challenges that I've outlined. But I have a great deal of hope, because I believe there's the intellect, the ideas, the passion, the commitment, and the energy amongst us to address these challenges in the future. And I do think it is the system that constrains us. So far from bringing down the silos and making things easier to work with vulnerable members of the community, successive governments have, perhaps unwittingly, actually reinforced them. The evidence, and it's what I hear from many of you in many different forms, the workaround. Those things that you and your staff do on a daily basis to join things up for people and families to get a positive response because it makes sense. And this is why things must change. We face a range of demand, complexity and financial pressures which, if left unaddressed, will mean more and more people will live increasingly precariously at the margins of society. But the sector will always drive for improved outcomes for vulnerable people and their families. It is this spirit which brought us together over the last 3.5 years, and it has informed countless discussions, papers, sessions and ideas. It led to Professor Shergold's work in conjunction with VCOS and many of you in this room. And it's led to valuable policy thinking put forward by VCOS, VicServe, VADA, NDS, Centre for Excellence, and many individual organisations and individuals. The wisdom and experience of this sector is invaluable to me as Minister. And there is certainly momentum for change. And I know that change is difficult, and that people will be uneasy when impacted, and that there will be uncertainty for clients and for staff of those agencies which will see change, often after many years of little change. And at times, I confess, I feel a nervousness and an uneasiness as well, but I have faith in the ultimate goal, that we are working towards achieving and supporting better lives for vulnerable Victorians. And I have confidence in the relationship that we have developed, in the processes we have established, and in the robust conversations that happen at all levels. So take the mental health recommissioning, for example. From 1 August, we'll have a strength-based, flexible, client-centred approach to mental health community support services. But there is some uncertainty at present as we're in that transition stage. And we are learning from the mental health recommissioning as we finalise the alcohol and drugs recommissioning process. As I've said a number of times, we must learn from what we're doing, refine what we're doing, adjust it accordingly as we go through these reforms together. If I can get this to work, it does, fantastic. One of the key aspects of refining and learning and improving is taking a collaborative approach to what we know, and so we formed a group of government and sector leaders to come together to advise government on change processes. So the Community Sector Reform Council was set up last year, and it's met a number of times since then. It's determined that there's 3 priorities for its work. Firstly, outcomes, embedding a stronger focus on articulating and measuring outcomes across all services. Capability, improving sector efficiency and effectiveness through stronger governance, more flexible funding arrangements, and removing unnecessary red tape. And collaboration, trialling new forms of collaboration at the local level, targeting and improving outcomes for vulnerable Victorians. So there's working groups, as the slide shows, across each of these, co-chaired by public sector and community sector leader, and they're now open for input, and I'm informed that consultation on these issues are planned throughout the rest of the year. And I'm also pleased to be able to inform you today that in order to support the Council in its work, the Government's going to provide $1.8 million over the next couple of years so that initiatives can be pursued in each of these 3 priority areas. Things like leadership scholarships for emerging community sector leaders, grants to build organisation capability, and the development of a genuine outcomes framework. The Council, on advice of the working groups, will decide how best to allocate this funding to support collaboration, capacity and outcomes. And in addition to this important work, I'll also be asking the Reform Council to review the processes and outcomes of the significant recommissioning of community mental health and alcohol and drug treatment services, and will make available to them relevant evaluation material to support their work. These recommissioning processes started well prior to the establishment of the Reform Council, but we are learning a great deal and there is always more to learn. There will be no further wholesale recommissioning of DHS services until I have received advice from the Council to guide future approaches. So we see this as a really important part of the discussion, the learning, the refinement and the improvement for the future. Now in DHS we have over 100 programs, and there unfortunately sometimes are many hard lines between each of these programs. Many aren't integrated and aren't coordinated. They're likely to be run and reported on quite differently, and many of you would live that every day. So when the client comes through the door for support, we're inevitably ending up working with them on one of these programs, and they're forced to fit into that program criteria. Unless we reset this structure, our workers won't have the freedom to support clients in a holistic way, looking at all their needs and the drivers of their vulnerability. That's why we have Services Connect. Our model for all of human services that aims to fundamentally change this picture so that we can all do more of the work that we want and need to do with our clients. Of course, we can have new programs. There will always be a need to provide specialist services that are designed to meet specific need, and they are still a critical part of the system. But they must work with each other and better support a more integrated and collaborative way of working. And you can see from the slide, and many of you will have seen this before, and some of you are already working in the system, when we work with clients, one need identification, one key worker, one client record, and one plan to address things going forward. Now, we've achieved some encouraging results so far. We know that in a significant number of cases we have seen across the 2 years, 75% of those clients that exit from Services Connect reported resolution, improvement or self-management. We also looked at about just over 100 clients over a 6-month period after they'd finished working with Services Connect, and found that they were less likely to be involved in statutory services. There were significant decreases in the number of child protection reports, investigations and substantiations, and there was also a significant reduction in out-of-home care placements. Now, this is only a small sample, but this suggests that following support through Services Connect, a client is likely to have less frequent or less intensive involvement with child protection, and that we can divert these clients from the statutory system. To date, Services Connect has largely been run within DHS across 5 sites, which are now expanding to 9 sites up there on the slide. And we want to make sure these results can be replicated across both government and non-government providers, which was why I was very pleased in the budget to be able to announce $17.8 million to fund 8 sector-led Services Connect trials. There's funding to establish up to 8 sector-led, community sector-led areas, and this is where we test and refine the model together. During the coming week, I'll be releasing the expressions of interest for the sector-led Services Connect pilots. There's a time frame, there's information sessions coming in the next week or 2, and I genuinely encourage you to engage with the other providers in your area and to consider putting forward an expression of interest to be part of driving forward the trialling, the learning and the refinement of the Services Connect model. The other reform initiative I've released just this week is the establishment of the Children and Youth Area Partnerships. Now, no one person or group can address child vulnerability on their own, so collaborative, place-based responses, such as area-based partnerships, will allow the right people to come together around a common agenda of the safety and well-being of children. Area partnerships will have more localised information than any group has ever had before. They'll share that information, plan and set shared priorities, coordinate their services, coordinate new responses as needed, and monitor the performance. They'll be encouraged to engage with the community in each of these activities. But we will be very clear that actually bringing together these groups is about improving outcomes. And the initial priorities that we are setting are the following: increased participation rates for children in kindergarten and school, increasing literacy and numeracy in young people in out-of-home care, and reducing child protection substantiations and out-of-home care placements. Now, each of the area partnerships will be able to determine their own priorities as well, but we are saying these are the three from our perspective that right across the state we're trying to drive improvement on. The 8 areas that will start with an area partnership, we're going to start in 8 areas, trialling it once again, and you can see from this that the model will be tested, refined and rolled out across the state. So there's some detail that I released yesterday on that, and there's further detail on the DHS website. I took the opportunity in preparing today to look back on my first speech to the VCOS Summit as a minister. And 3 years ago, I stood before you to open a conference titled "What's Happening, What's Different, What's Possible?" Excited about the possibilities of a new government, but also as being minister. And here's what I said at the start of that speech. I went to the election promising Victorian families that we would drive the rejuvenation of community services and that they would see a real improvement in the quality of support. Every day we are working to honour that commitment, and I genuinely believe that together we can make a substantial difference across a range of areas. So I spent a few minutes looking across the speech to see if we'd lived up to those expectations that I set back 3 years ago. The same week as the VCOS conference in early August 2011, the Productivity Commission provided its final report to the federal government on the National Disability Insurance Scheme. I said in my speech, in my view, the NDIS is an idea whose time has come, but we still have to make it happen. Well, we are making it happen. Less than 3 years after the report was completed, thousands of Victorians in the Barwon region are living the launch of the NDIS. There's a long way to go, but the pace of change has been absolutely remarkable. I also told the gathering in 2011 that another key priority of mine is doing all we can to protect vulnerable children. The Protecting Victoria's Vulnerable Children inquiry was underway. The Betrayal of Trust parliamentary inquiry was yet to be conceived, and the Royal Commission was not even a twinkle in anyone's eye. I said in my speech, at no stage have I been under any false illusions as to the challenges we face here. Now, challenges remain, but we have a clear way forward with our new child protection operating model, with the vulnerable children strategy, and our 5-year out-of-home care plan and development of a complementary out-of-home care plan for Aboriginal children and young people. These plans are backed by investment for vulnerable families, which has increased by over $900 million across the last 4 budgets. In 2011, I said to you that I want strong systems around governance and accountability, both for my own department and for the CSOs we fund. The shake-up of the Department of Human Services has been pretty robust, with a silo-busting approach and a strong focus to the local areas. After a period of self-reflection, I think the department's new structure is bearing fruit. The Community Sector Reform Council provides a way forward for the governance and accountability running both ways, as we also reform and refine and improve the relationship between government and the community sector. In 2011, I said to you we need to improve our system of individualised cross-functional case management. Families and individuals are complex, and rarely are they a perfect fit for our pre-designed services in their silos of disability, child protection, housing, mental health, drug and alcohol, etc. We are investing in what a coordinated response for individuals and families with complex needs can look like in Victoria. There are lots of challenges around changing culture, valuing collaboration and managing privacy concerns, but we are absolutely up for it. I talked at length about the system issues we had identified. Today, the vision I outlined in 2011 has a name, Services Connect. And as I've outlined, Services Connect has already helped in nearly 1,000 families, and I am convinced that we are meeting the challenges that I outlined. There is a lot of reform underway, and change is challenging. but I have a real hope and excitement about what we can achieve together as we get the settings right. All of our initiatives so far, Services Connect, local area partnerships and recommissioning, are designed to better understand needs in communities, intervene earlier with a comprehensive response, and give those we serve a greater say in how their support is shaped. To fix the system, we need to cut back on the complexity that comes from multiple layers of support and give people one clear plan and one key worker, as we're doing with Services Connect. To fix the system, we need to aggregate funding streams, allow flexibility and wrap services around people, as we're doing in mental health and alcohol and drugs. And to fix the system, we need to ensure decision-making and influence at the local level, as we're doing and seeking to do with our child and youth area partnerships. Today's summit is about setting the agenda. It's very important to learn from the past and to look forward to the future to make sure we're defining and articulating what we want to see. I believe that our collective work over the past 3 years has set an excellent framework and a pathway for positive reform for the future. We will only achieve our goal of comprehensive, seamless and timely support for vulnerable families if we work together, as we have done to date and as we plan to do in the future. This is a very exciting journey and one that I look forward to sharing with you in the future. Thanks very much.